Okay, welcome everyone. We're so glad you were able to join us today to learn about artificial intelligence and health information. We'll start officially in 1 minute. There's some attendees are just joining us, so we'll just take a brief pause before we officially get started. But just wanted to thank you for being here today. Okay. Well, welcome everyone. We're really glad you were able to join us today for the MHIKNET education session on artificial intelligence and health information. This is the second of 3 education sessions scheduled for this spring. And so make sure you also register for the one about misinformation coming up in June. And with that, I'll turn it over to MHIKNET librarian Gail, and she's going to provide additional introductory remarks.
Sure. Okay, so today's session is part 2 of Artificial Intelligence, AI, and Health Information by Mê-Linh, who's our guest speaker, who is a health science librarian from the University of Manitoba. And today we're going to use Zoom webinar. So Mê-Linh, if you could just advance the slides, they should go pretty easy through. So we're using Zoom webinar today. So you have the option of turning on your closed captioning. You can also ask questions in the chat box at any time if you want, and you can also use the reaction features and give a thumbs up whenever you want and show us what you think. So we'll just do our land acknowledgement. So the University of Manitoba campuses are located on the original lands of the Anishinaabe, Inninewak, Ansininewak, Dakota Oyate and Dene, and the national homeland of the Red River Métis. We respect the treaties that are made on those territories, acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in the spirit of reconciliation and collaboration. So Mê-Linh is here with us today, who's going to be providing more information for us on AI. And then the objectives of today's session we're going to start by talking about MHIKNET's library services, how to create effective prompts to locate health information, and describe at least 2 AI tools that can aid you in your practice or your research. So what is MHIKNET? MHIKNET is Manitoba's Health Information Knowledge Network, and we're provided by the University of Manitoba Health Sciences Libraries to the staff of Manitoba Health, fee-for-service physicians across Manitoba, and staff of participating regional health authorities. And then we just have the regional health authorities here, and the only kind of excluding part is Brandon. But if you are located in Brandon and part of Prairie Mountain Health, and you're not sure whether you would qualify for our services, just send us an email, and we'd be happy to help you out with that. So the MHIKNET team is Orvi, who is the head of outreach services, myself, who's the MHIKNET librarian, and then we also have Cheryl, Pam, and Kathy, who are our library technicians, and they're usually the people that you will email if you email our general email account, or if you call us. They're usually the people who are answering phones. So our MHIKNET library account is free. All you have to do is complete a borrower registration form that's located on our website. Fill that out, and then you can email or fax that back to us, and we'll get you all set up with your account information. Our core services for MHIKNET are our literature searches. So if you have a research question that you want answered, just send that to us. Could be via email, or we have a form online that you can fill out, and we will do the searching for you in the databases, and we will send you a results list that you can access some of different articles and information on that particular topic. Then you can use document delivery to get the full text of anything for free. If you hit a paywall, you're Google searching, you can always request the full text from us, so never pay for anything online. All you have to do is send us the citation of the article that you're trying to access, and we will get that to you. With your library account, you also have access to UpToDate, which is a clinical support tool, and you can log in and access information directly yourself with your own account. We also offer training, education, and orientation sessions like the one we're doing today. We have a number of different topics. We have some videos online through our website. We will also do in-person or virtual training sessions for you if you have a team that wants training on something. We're very happy to either come up with a new session or any of the older sessions that we've done. We're happy to do that specifically for your research group or for you individually if you want more information. And then we also have a current awareness service. So if you want to stay up to date on a particular author or a topic, we will set you up and you'll get weekly emails on that particular topic sent to your email address. Okay, so today Mê-Linh is going to be using Menti to do a few different questions as we go through. I don't know if you had any more information on Menti, Mê-Linh.
No, yeah, I think I can, I'll get started, I guess. And so Menti is if you've never used it before, it's just a tool to kind of get anonymous feedback and kind of see where everybody kind of is coming from. So that's what I wanted to do today, to kind of dive into the topic. And just to kind of thank you, Gail and Orvi, for the warm welcome. So yes, my name is Mê-Linh Lé, and I'm one of the health sciences librarians here at the University of Manitoba. And I've been teaching on AI, mostly about generative AI, which I'll talk about for the last couple of years, and have been meeting with a lot of different researcher groups and faculty members and students. And I haven't had the chance to talk to kind of practicing health professionals about the topic. So I'm excited to hear from you and your experiences, or just questions about kind of AI. And it's a very big, broad, encompassing topic, and everyone has different experiences with it. So Menti is going to kick us off, but throughout the presentation, if you have questions, feel free to throw them into the chat. And if I don't see it or don't notice it, somebody can feel free to interrupt me. I'm always happy to be interrupted with a question. But so Menti, you can use the QR code if you want to scan that with your phone, or you can just go to menti.com and enter the code that is listed there. So I'm going to flip over to our Menti and just get started. Okay. So it comes up there again, and the join code will stay there. I see at least 2 people in here, which means that at least it's working. So I wanted to get a sense of whether people have deliberately used a Gen AI tool or generative AI tool, such as ChatGPT or Copilot, in the past month. And I try to be clear about it. It's a deliberate use, because a lot of what's happening is now these tools are kind of being embedded, and you are using them kind of whether you want to or not. So this is intentional use, and within the past month or so. So more are kind of saying no as opposed to yes, or evening out a bit. And also it's possible that sometimes, again, you might not even know. Anyone who's done a Google search lately will know that kind of those AI overviews pop up, whether you want them to or not. Okay, so we're kind of split a little bit about use. Okay, a little bit more yes. Great, thank you. Okay, so this is just kind of comfort level. And just to see, are people comfortable with kind of the general concepts and how generative AI might be used, so those practical applications. And I always like to say that when I give these kinds of sessions, that I in no way consider myself an expert. The field just changes so rapidly, but it's just about, could you talk about it with somebody else, explain kind of the basic ideas and use it. And that's where we're kind of going today. Okay, so more not experienced, some in the middle, and one very experienced. So again, feel free to share your experiences or ask questions. Love to hear from other people. Okay, so what Gen AI tool have you used the most? And this can be at any time. And I've already found kind of in my own use that I have my own preferences, and sometimes I can't justify why it just tends to be the ones that I go to, or which one is having a free trial that month. But we're definitely seeing, yeah, ChatGPT. And Copilot, for those of you who don't know, is Microsoft's, it's embedded, if any of you are in kind of Microsoft work environments, it's kind of embedded into our suite of tools. Okay, so mostly ChatGPT and Copilot. And okay, and this is good because I'm going to be talking about some tools that are not these two today. So just to kind of get you familiar with some other ones out there.
And Mê-Linh, if I can just pop in for a second,
Yeah.
for anyone who is wondering how they can participate in these Menti polls, because I noticed only about half of attendees are submitting. So you just see the instructions at the top of Mê-Linh's screen here, which is go to menti.com, and then you put in that 8-digit code, and then you can participate in these polls.
Yeah, thanks, Arby. And I can see that there's a bigger group there, and some people just don't want to participate, and that is a-okay too. That's often how I can feel sometimes. Okay, so this one, I'm just kind of interested in how people, if you have been using these tools, how you're using them in your work. And I think it can be very different with how you're using them in your personal life, if you are at all. And I'm going to kind of be talking exclusively about how I use it in my work as a health sciences librarian. And yeah, if you don't use it for work, that's a totally valid response as well. Yes, cleaning up language. Who hasn't used it to help you kind of write an email that you're struggling with? Yeah. Okay, professional writing. Okay, great. And I'm going to come back to this one later too. So just in the interest of time, I will leave this because I want to make sure that I get through everything. You can flip back and forth to it, and I'll come back to it at the end. But I also wanted to make you aware that I'm going to, oh, actually, you know what? Sorry, I must have missed it. I thought I had one for questions at the end that might come up, but feel free to throw them in here if you don't want to throw them in the chat if you have questions or concerns. Wait, let me go forward. There we go. So yes, feel free to enter in anything here throughout the session, what you're hoping to gain, and hopefully I will address some of them in the session today. So I'm going to flip back and I'll come back to it at the end. I'm going to flip back to my slides here and we will start diving in. Okay. So, and I have a very sensitive mouse, so I'm always flipping ahead to slides. So for an AI background, I do recognize that some of this may have been covered in the first session, but I also know there may be some new attendees here. So I wanted to give a brief overview of AI kind of in general before we move into how it gets used in, or how it can be used in your kind of health sciences work. So kind of a caveat that AI is an umbrella term, but sometimes it gets used to talk about more specific types of AI. So generative AI, you'll see, is in kind of the smallest circle down on the bottom. And I try to be specific that I'm talking mostly about generative AI, although sometimes I may just shorthand say AI. But generative AI is probably the one that most of us are most familiar with in terms of, it's just the one that is talked about in the media the most. It is the generative, the tools that kind of create new content, whether that's text or pictures or video, based on the content that it has been pre-trained on. So then generative AI fits within deep learning, which then fits within machine learning and fits into the broader kind of term of artificial intelligence. So sometimes things are just really intertwined, so it's kind of hard to separate. And again, I'm mostly going to be talking about generative AI today, although I will note that machine learning in particular is playing a larger role in kind of health sciences research, if any of you are ever involved in, say, review projects. But mostly today, we are going to be talking about generative AI. And so before we can kind of get into the fun stuff, we have to understand kind of what's going on behind the scenes and what some of the terminology that you might see that is associated with AI, and specifically Gen AI. So one of those terms is large language models. So these large language models, shorthanded to LLMs, they are designed to for natural language processing. So they are trained on these massive amounts of text and media. And this is when you kind of hear about all of the information that is within these models. It's just taking massive amounts of information that they then use to train the models. And what happens is, based on kind of all that training data, it can then generate new content in the form of, say, language or other media. And it's done a lot through kind of natural language processing, which is meaning you can kind of ask it a question like you would ask a colleague, as opposed to how searches used to work, where you would have to put in kind of very specific terms to get a good answer. So these models are really making predictions on what words or phrases or sentences or paragraphs are likely to come next. And large language models can be proprietary, they can be open source. And when people are kind of talking about the expense that goes into these models, this is mostly where the expense is. It is in training these models and these data sets. And I've listed 6 of the kind of the biggest ones that are out there right now. OpenAI is the maker of ChatGPT, for example. And Meta, which owns Facebook, is the maker of Llama. So these are the different models, and then they get used in different ways. And not that you necessarily have to see it, but there's huge long lists of these and comparisons between all the different models. So if you're thinking of these large language models essentially making text prediction, I like this example to kind of explain what's happening. So it kind of works like a very supercharged autocomplete. So if you can see here, I have my kind of text. I read a good blank last week. So what it does is it takes that kind of word or the words there, which are translated into tokens, and it kind of gives it a mathematical probability of what word is most likely to be filled in here. So you can see here my made up numbers, but what word is likely to fit into that sentence. So you type in the text, and then the model uses that as context to kind of guess what word or even piece of a word is likely to come next. And it can make guesses based on kind of your own patterns and who you are and how you have used the models and what it's seen before. And everything is based on patterns. So because the model has been trained on these huge amounts of text and has learned patterns, like which word likely is to follow another and how sentences are typically structured, it tends to follow that pattern. And oh yeah, I think I will talk about, I'm not going to get into, I'm going to ignore tokens, but just know that everything is done kind of, as opposed to words, tokens, everything gets broken up into little kind of bits before kind of the whole probability thing kind of comes into play. And it doesn't, when you put in something into these models and something is generated out, it's not just choosing the next word randomly, it is assigning a probability to all of the possible tokens or words that could come next, and it picks the most likely one. Or it kind of can pick a random one based on those probabilities. And what it does is it does this process kind of step by step. So it predicts the next word, and then the next word, and then the next word, and it builds up sentences and paragraphs kind of word by word. And there's a lot of nuance that I'm leaving out here, but it's just to know that it is not just kind of spitting things out, that there is all of this kind of probability behind everything. So I think that's kind of most of the background. And I wanted to talk a little bit about prompts. So what you're putting into the systems. So prompts are Oh, sorry, there we go. They are what you, the user, the input that is given into these tools, these generative AI tools, to guide what is created, the output. Excuse me. And the inputs and the outputs, prompts, and what comes out of it can be multimodal. So what that means is you can put in something using text, you can write something and it will write something back to you. You can speak to it and it will speak back to you. You can put in an image and ask for a text response. On some of the kind of even fancier models, you can show it a video of something and it will interpret that video and then provide a response to you. So really, all the different forms of inputs and outputs can vary based on what your needs are and kind of how you want to use it. And just to emphasize that each output is unique. So that's why even if you put in the same prompt, kind of even one after another, you will get different responses. And so it's not kind of transparent in that same way. That's just kind of how these work, because it's generating new content each time. So even the same question is not going to result in the same answer. Obviously, there will be similarities and you'll see some overlap, but really each output that's created is unique. And the more time you spend creating a good prompt will improve the output. So as opposed to just putting in a single sentence that you haven't really put a lot of thought into, and then you're kind of like, well, why isn't this a really great output? Spending some time on how you phrase your prompt will really improve what you see as a result. And there is a framework that has been designed to kind of help you think about how to structure your prompts to get more effective AI kind of generated outputs. So I'm not going to go through each one of these, but I wanted to just show you some of the things you want to think about. So you want to think about how concise you are. You want to use very clear and simple language. You want to be logical. So if you're most interested in a specific topic, put that at the very front end of the question as opposed to the bottom. Be very explicit. If you want things in bullet form, say that. If you want 5 examples as opposed to 3 examples, indicate that. Tell the system where you're coming from. Are you a first-year practicing physician, or have you been doing this for 30 years? Give background on who you are and what kind of information you're looking for. In terms of being flexible, often in many cases, my first prompt is not my last prompt. So be willing to change things based on what you're seeing and kind of take different approaches if the output isn't what you're looking for. And again, these tools are never going to get tired. You can keep asking it to redo its work as many times as you want until you get what you're looking for. And really think about the responses that you're getting in terms of, if it's not what you're looking for, what could you change in the prompt to kind of more accurately get what you need? And it says here, encourage AI to think creatively, but also if you think creatively about how you are framing these prompts and kind of change things, again, the quality of your outputs will improve. So I wanted to give some examples of different kinds of prompting. So this is what I would consider an okay prompt. And that might be how you just kind of the first thing you type in. So, find information on managing diabetes. So you have your basic, you're looking for information, you want to know about diabetes. That's all really you're telling the system. But if you improve that a little bit, how can you make it good? So now you can tell it, I want you to search specifically for clinical guidelines on how to manage type 2 diabetes. And I want it for the guidelines to focus on adults. And I want it to be targeted at family physicians here in Canada. So you can see how much more context and specificity I have put into kind of from one prompt to the next. And then what I would consider kind of the best prompt is using Canadian clinical guidelines and evidence-based resources, find the most recent recommendations, 2020 or later, for managing type 2 diabetes in adults in a primary care setting. I want you to prioritize information relevant to solo practitioners in private practice, including medication algorithms and patient self-management strategies. So again, being more comprehensive and specific in what you are looking for and what kind of the quality of the information that you want. So I also will just, as my tip, when I'm prompting now, I almost always use the voice prompt. So I'm speaking this as opposed to writing it. And that itself will save me time. So if you haven't tried that out, I do recommend using voice prompt as opposed to typing all this out, unless you're a really fast typer.
I'm going to abuse my privilege of being able to unmute here, Mê-Linh. What is it? Just that it's faster that you use the voice prompt, or what's the incentive?
I find it faster, and even if you're typing, sometimes you're pausing and thinking. When I'm doing my voice prompts, sometimes it takes me a little while, but the system doesn't care. Like, it will let me have my long silences while I'm thinking through the best way to phrase the question. So I just like it for speed, for efficiency. Okay, so just to sum up on prompts, first prompt is almost never the last prompt. So really be willing to change it. And my caveat kind of for all of this, and maybe I should have started off with this, is that you need content expertise to guide the prompts, the quality of the prompts, and of course to evaluate the output. So if I put in that question or that prompt about how to manage type 2 diabetes, I mean, I don't have the content expertise to evaluate it. And even I would struggle coming up with the most appropriate prompt. Maybe you looked at that and you thought, oh, I could definitely improve that. So these tools are not a replacement in any way. It is something to help improve or streamline your kind of workflow to make you more efficient. So you obviously understand the terminology, you understand your patient groups, you're obviously, if you want to be very specific about geography and level, so all of that is tied back to your own clinical expertise to kind of guide how that prompt is created and evaluating those outputs. Oh, okay. And I forgot that was going to come up. And I also encourage you, again, if you've never kind of played around with the tools, is that almost all of them have the ability for you to adjust settings to better meet your needs. So I have a screenshot here. This is from ChatGPT. So if you are signed in, you can basically customize your ChatGPT. And I haven't even been super extensive here, but I tell ChatGPT what to call me. I tell it what my job is, essentially. And then I say, these are the traits that I'm interested in my ChatGPT having. So it might be a little bit small, so I'll just read it out. I want ChatGPT to be concise and evidence-based. I don't want it to pretend to know the answers when it doesn't, and I want it to source its claim. And then down at the bottom, anything else ChatGPT should know about you. I want it that I'm located in Canada, and I want kind of Canadian specific information whenever possible. So you can kind of see, again, people use these tools for such different reasons. I don't need my ChatGPT to be witty or poetic or use Gen Z slang. These are the things I'm interested in, and that will kind of improve the quality of the output. So if you've ever not been impressed with what you're seeing, some of these changes could really help. Okay, so that's the kind of the background stuff to situate us, and then I will get into kind of the actual tools. And oh yes, here are my caveats. I knew I had them somewhere. So again, they are a support tool. They are in no way a replacement for clinical knowledge. I also recognize that how they are used for healthcare is, for example, very different than if I was teaching, say, social sciences or students, right? So there's different precautions that have to be put into place and how that content is used, but I think it still has value. And obviously you would want to verify any output before you made any kind of judgment calls related to patient care. You would never want to upload any personal patient information into these systems. And it's outside of the scope of our discussion today, but things, of course, to consider are hallucinations, which is where these tools make up answers, a lack of transparency. No one really knows exactly how they work. So it's this black box. And there are a lot of different biases, again, that I could talk about at length that are in these tools. Some of these biases are the same biases that exist in the real world, right? But there are other biases that it is important to be aware of when you're using them and to consider. So things to think about. Okay, so now I thought I would show you some examples of how these tools might be applicable for your work. So I chose ChatGPT as my example to use here, and that's because I happen to have a premium account and I wanted to show you all the different kind of things that can happen. But I've listed some similar tools down here on the bottom. ChatGPT is the one we're most probably familiar with. Like these other models, it interprets and it uses kind of human-like text. So you put in a question like you would ask a friend and it kind of spouts it out back to you. Something that if you haven't spent a lot of time looking at these models, you might not be aware of is that within ChatGPT itself, it has a variety of different models that have different strengths. So whether you are using the free account or the paid accounts, you will have access to different models, again, that have to do different things. So this one here, GPT-4, I guess 4.0, I'm going to show you an example of what it looks like. Okay, and sorry, it always, when I share my my prompts, it always goes to the bottom. So sorry if this makes people a bit dizzy as I scroll up. So obviously I've put in a very basic question. You know, what are the best practices for deprescribing in older adults? So this is the prompt that I have put in. I'm just going to try and make that a bit bigger. Okay, and then it gives me a little summary text on deprescribing. And then it starts talking about different reviews, the different frameworks like beers, the different sources that are used for how you might want to do a medication review if you were interested in deprescribing. It talks about the shared decision-making process. It links to some articles. And then it talks about, again, how you might prioritize which medications, tapering, different algorithms, all these different things. And then it gives, at the end, it asks me a question. It says, do you want me to give you some algorithms for specific drug classes? So if I was interested in that. So I said, yep, give me an algorithm for benzos. So here then is the evidence-based deprescribing algorithm for benzodiazepines in older adults. And it says it's based on Canadian guidelines and peer-reviewed literature. So, and then they are listed here. So again, and then it also asked me, do I want a flow chart? And I said, yep, I do want a flow chart. And so that's what it has provided here. And then I said, okay, now I even want my flow chart adapted for clinicians, and it's here. So again, this is a very basic example, and maybe this is the kind of stuff that is very straightforward for you. But if you are just starting out, or if there is a new topic that you want to get familiar with, this is a great resource to quickly describe something, to list some of the main considerations. Can I speak to all of its accuracy every step of the way? No, I would want to follow up and learn more. But in terms of providing me with an overview of a topic, it can do that really well and can provide fairly good graphics for me to use if I wanted to kind of take a closer look at that. And it provides links to outside resources and to some articles. I haven't checked all of these articles exactly, but it does provide additional examples. So I work with a lot of different researchers and sometimes have to get familiar with new topics pretty quickly. This is my best way for getting introduced into a new topic and things I might want to consider. A second example here. It's going to take a second to load. Again, I got to scroll up. Okay, so what these tools can also do is provide infographics for you. So what I did here is I uploaded a Manitoba Health document related to the MMR vaccine. And I said, I wanted the ChatGPT to turn that information from that report into an infographic. So this isn't a perfect infographic, but I was thinking, you're working and you want some kind of visual aid for your patients, and you have, say, a great report that has a lot of helpful statistics, but how do you make this more accessible for your patients? So this image was created, within seconds. And here is some information on what measles, mumps, and rubella is, why patients might want to get the vaccine and some side effects, that kind of thing. And then I can get even more into it. I say, okay, we'll use the statistics from that report to generate an infographic. And there that is there for me. You can make so many modifications. I could ask for changes to color, to what statistics I wanted it to pull out. It all just depends on kind of how I prompt it to get more information. So all of these tools allow you to upload reports, presentations, all those kinds of things, and then ask about it or use the information within them. So this is kind of the basic model. You can see here on the left-hand side, these are the different models that are out there. So just so you know, I'm on this one right here. Great for most tasks. I also wanted to show you the reasoning model. And this one is trying to show you a little bit more the thought process behind it. So you can see here, I asked it the same question, what are the best practices for deprescribing? If I click on the thought for 6 seconds, it's going to show me what it did. So you can see here that it is pulling from some of the same things that I had written in my settings. I want concise, evidence-based text. It's showing me where it looked. These are all of the academic sites and some newspaper sites that it is pulling from. So you, again, if you're worried about where this information is coming from, like, is it coming from Reddit? Well, you can check where is it coming from. So that, and then it's also going to cite, in the first example, it didn't show me where it got the resources, but now it's linking out to them, excuse me, if I want to go follow up and get more. There's also, I will show you, this one is a paid one, but it's something to be aware of that it's out there. This is the deep research, sorry for dizziness, the deep research one. This is where it actually takes several minutes to dive into a topic. So I was working with an occupational therapist who has been tasked with a specific looking at staffing ratios for a new outpatient rehab clinic, and she wanted to kind of know what are current guidelines. So I asked that question. I want information on staffing ratios. It then followed up with a lot of specific questions to me about, well, what healthcare settings am I interested in? What kind of staffing ratios do I want? Do I want Canadian or national or, pardon me, or provincial standards? All these kinds of things. So I gave all that kind of answers. It then took quite a while to come up with the answer. And it looked at then providing me kind of a detailed report on staffing ratios. And what I liked about this is it pulled out specific numbers for me. And so this, of course you can do this, but the amount of time it would take you, for example, to look through all of these documents and pull out the numbers for staffing ratios, I mean, that's a big time commitment. And it's giving me numbers here that I can provide back to my kind of patron on what kind of, you know, what staffing ratios do you need in terms of FTE, and for the different, say, PT versus OT. And I'm scrolling down a bit to show you that they also then provide a table on different regions on the staffing ratios provided and kind of all of that. So again, the amount of time that it saved me, I would want to, of course, again, review this in depth, but the amount of time, if a patron had asked me to do this work for her, I wouldn't have been able to do this. It would have taken me too long, and I don't have the capacity to do that, but I was able to provide this to her with, again, that caveat, like, you want to review this closely, but this might be a good jumping off point and a lot of helpful resources for you to look at the topic of staffing ratios in kind of outpatient clinics. And the last one I wanted to show you is, this is from a different model. This is Claude. But the reason I wanted to show it to you is just to see that you can get different kinds of questions. So in this one, I put in a very, like a PICO question related to UTIs and different drug courses. And it's going to break it down 3-day versus 7-day and talk about what efficacy, advantages of different courses, different considerations, and et cetera, et cetera. So it can be, these tools can be very helpful for these kinds of questions. So that is kind of ChatGPT and Claude, and I've linked them there. And then I also wanted to show
Caitlin,
you, oh,
we
yes.
we did get a question in the chat
Oh,
asking
okay.
loosely about how safe these things are when creating resources or answers or reports for patients. So thinking of clinicians who are trying to help with provide answers to patients or directions. How safe are they?
Yeah. So if we think back to 2022, when these tools first came out, there were a lot more hallucinations, and in terms of making up answers or answers you couldn't trust. But what's changed from now until then is that many of these, in addition to their training set that they're looking at, they're also tied in real time to internet sources. So what that does is it kind of grounds that information and makes it more, like, it makes it safer, kind of, so to speak, in terms of it is pulling from information that is online right now. In the one that you saw, the reasoning one, excuse me, it showed you where it was getting all that information from. So you could say, okay, well, do I trust Nature? Do I trust, Web of Science or Elsevier, these big health sciences publishers, in terms of where it's pulling the information from? So tying back to my caveat, because it's patient care, would I always want to double check in terms of if I was making kind of controversial or I wasn't quite sure? Yes, I would always want to double check. But what this does is it saves you time to know what you need to double check. So in the example I showed between the 3 versus 7-day drug course, what are the pros and cons? You're a healthcare practitioner, you would probably want to click through to those articles to say, okay, is it actually saying this? But these tools aren't making up content in the same way as it was happening in the past. So I would say much more trustworthy than before, but patient care always requires your own clinical expertise and checking before you want to apply that to patient care.
Thanks. And if I incorrectly summarize that, or if you still had some questions about that, definitely pop those into the chat as we continue. Thanks, Mê-Linh.
Yeah, thanks, Arby. So another tool that I think has been getting a lot of popularity is called Elicit. So Elicit, what it does is it combines a large language model like ChatGPT, but then it ties it to scholarly sources, so academic resources. That's pulling from another resource, or it's called Semantic Scholar. And what it does is it's kind of like it's helping you with literature reviews and showing you connections between papers. So you can ask it questions and it will search the literature to kind of help you get answers. Or if you already kind of have a lot of PDFs on your topic and you want to put them all into a resource like this and then kind of talk to them and identify common themes or patterns, you can do that with this tool. So I'll show you an example here. This was a question I kind of, excuse me, it was the same one that I had in Claude related to SGLT2 inhibitors for cardiovascular and kidney health. And so I've just asked it, basically, what's the recent evidence on these inhibitors that show cardiovascular benefit and towards kidney disease. So what it does, I'm going to scroll down a bit, is it provides a summary of 4 papers. If you're willing to pay, you can get up to 8 papers that it provides a summary. So again, summarizing some articles on the topic. And then if you scroll down, what you can see is it's doing a literature search matrix for you. So it's showing you the articles, it's showing you where they're published, how many citations they have, so how well cited they are. And then if you scroll over, you can see what it does is you can have different columns. So I can say, okay, what are all the outcomes that are measured in these? So if you want to compare them, what region, where was it taking place? On the right-hand side, you can see there's a variety of different columns that I can add. I can add in, okay, I only pull out the content related to what interventions are being used or how long the follow-up is, all those kinds of things. So you can have many papers that it does this lit search matrix for you. And then you can also add additional steps. So you can extract the data from those papers. You can ask it to identify additional concepts that come up from those papers. You can ask it to summarize concepts, or pardon me, abstracts from papers that you upload. And you can even start talking to the paper. So you can ask questions of these papers, like what are all the limitations that I should be aware of? Those kinds of things. So Elicit is, I think it has a lot of potential to help. There's questions about what articles it is pulling from and which ones show up here. And again, it's not always pulling from the full text. You can make modifications so that it's pulling from the full text. But again, it can be a helpful, quick tool if you want to look at a variety of articles and do these literature search matrices right away. In the slides, and I'm happy to share my slides later. I think I had meant to put them up online and kind of forgot. But I have a comparison here between Elicit and some other tools that do the same thing that are out there to kind of help you with the literature review process. And I really like the matrix and just dividing up my content for me like that. I feel like it's a big time saver. And I have some screenshots just to show you. This was another question I did on cell phones and their impact on students in school. You can see that's a very bad prompt. I should ask more, provide more detail. But again, it kind of gives me an overview of the topic and gets me started. Just conscious of time, I will, because I think we're done at maybe right now. So let me just, Orvi, cut me off if I need to stop talking. I just wanted to also show you Research Rabbit. So Research Rabbit, if you are starting looking at a topic and you want to know how else is this talked about in the literature, Research Rabbit can be really helpful. It shows you the relationships between topics and researchers, and can point you in different directions that you might want to explore when you are looking into an area. It can be very helpful for interdisciplinary topics. I would say also emerging areas where you're having trouble finding literature on something. So I'll show you my example here. Oh, and I had the slide up. Sorry, I didn't summarize that. But again, Research Rabbit, what you can do here is, again, I've put in my topic of cell phone usage, and then you can explore papers related to this. So I'm just going to click on it. So all of these are papers, say, that have talk about in some way. Let me go, for example, to this one. These are similar works. These are articles that are in some way related to the topic of cell phone use and students. I can go in and click each one of these and then read the abstract of that paper. And then go in and look at, well, who are those authors? What papers have they cited? So it's you kind of go down these rabbit holes, right, of finding more and more related content that you might want to explore on a new topic. So I think that one can be quite helpful too. Let me go back to my slide so you can see there. Yeah, so this is Research Rabbit. I would say, yeah, again, very good for interdisciplinary and emerging areas. And it really helps you visualize how scholarly communication on a topic works. And I've listed it. Oh, yeah.
Yep, two questions from different chats. One is just about if anyone is using AI for their dictation. So they're including like a patient name or age or that kind of information. Is that a safe thing to do right now? And I'll let you answer that, and then I'll ask the other one.
I would say in terms of dictation, I don't know enough about those tools. I know I've read, excuse me, some articles on how AI tools have been a huge time saver for that specific feature. So you're not, say, charting and writing everything out like that. I would think you would want to seek out a very specific dictation tool that is geared towards health professionals and has those safety guardrails in effect, as opposed to a dictation that is just, say, tied to, I don't know, like Microsoft or something, and maybe is patient care and patient safety is not at the forefront. I would suspect that some of these dictation tools that are being developed for healthcare would have to go through, is it like FIPA, right? Or is that the states? Those things to make sure that they are within a locked system and not being fed back into, say, these training tools. So I think there's a lot of potential. I would just want to make sure you're using the right dictation tool for patient care.
So in this moment, take caution with anything that has any kind of patient information. And then the second question is about just in the example you were just providing, which is about are these AI tools able to go into behind paywalls, into the journals that currently cost money, or are they just utilizing open access resources?
Great question. So the bulk of these tools are pulling from a resource called Semantic Scholar. So Semantic Scholar, I think the number I saw most recently was like, let's say 223 million citations versus PubMed, which is usually, I think it's around 39 million citations. So Semantic Scholar, as you note, it has access to open access articles, and it will look through them when it has that available. But yes, it is a lot of, it can't get behind paywalls, so it isn't looking at that content. I think that is, as a side note, I think that is an encouragement for if you are publishing to publish open access, because it does make it more available for these kinds of tools to increase, say, patient everybody ability to access their healthcare kind of evidence. But I will note that some tools, so I didn't talk about it here, but I've linked it over here. This tool right here, Cite AI, some of these tools have negotiated with publishers to access full text articles. So Cite has negotiated deals, so it would have access to more full text content than some of these other ones. So sometimes if you're trying to figure out which one you want to use, that might be kind of a deciding factor. And this comparison here talks about that a little bit, how much evidence you're actually able to access. But when you look at, say, this part right here, what it's pulling from, a lot of it is pulling from the abstract, again, unless you kind of toggle a feature that tells it to look for full text articles. But you could also upload your own full text articles. It's a closed system. You don't have to worry about copyright violations. And then you could pull out from those articles if you want it. So does that answer that? Let me know if there's any follow-up, Orvi. I'm happy to address that some more too. Okay, oh yeah, so sorry, those are just my other, my screenshots in case Research Rabbit wasn't working when we were looking at it. The last one that I wanted to talk about is called Google Notebook LM. So this one isn't, it's a little bit different. It calls itself a virtual research assistant. So it is, again, it's also a closed system. So you're not uploading, say, PDFs into a training set for ChatGPT. But what you can do is upload a variety of different forms of information, and then you can interact with it. So if you had a whole bunch of reports that you needed to read and summarize or synthesize or pull out common, like, all of these 10 reports, and you wanted to know, well, how often do all of these talk about resistance to vaccines, for example, you could upload them there, and then you can pull out a lot of information. So I'm going to show you mine so you can see kind of how it works. And Google Notebooks is free. So just so you can kind of see, for example, this one here is a research project that I'm doing related to, it doesn't really matter what it's related to, but from it, I had free text responses in an Excel. So I've uploaded that into Google Notebooks. And then what it does is it looks at those answers, or pardon me, kind of the information, the text, and it identifies themes that I might want to think about. And then over here on the right-hand side, I can ask for specific things. So I can say, give me a timeline from this text. So if there was historical moments I wanted to talk about, or if I wanted a briefing document that I wanted to share with somebody, it would provide a briefing document. It will also, if you are the type of learner who learns best by hearing information rather than reading it, you could upload some PDFs on a topic that you're trying to learn about, and it will create an audio kind of podcast about the topic. And what you'll hear is hosts talking about a topic back and forth, and it's scarily real. I'm a kind of person who learns best by hearing, so I have found it really helpful if I'm trying to understand a kind of thorny topic, to put it in here and have it kind of explained to me through conversation as opposed to reading a PDF. So depending on your learning style. There's a lot more that Google Notebooks can do, mind maps, all these kinds of things. So that one, I would just encourage you to explore it on your own. How can it help your workflow to use something like this? Okay, sorry, there we go. Okay. And then I threw in some other ones here. I won't go into them, but just tools to be aware of that are out there. PDF readers that allow you to summarize and talk to a PDF. Sorry, this is my mouse being very sensitive. Some ones that aren't necessarily generative AI, but that are within the healthcare field. Trial GPT, which I think has shown incredible promise about how do you match patients with trials using AI. The big product out of Google is this MedPalm. It's not available in Canada yet, but it is a large language model specifically for health research and patient care that is kind of in development. And I know many of you are up-to-date users. It is currently trialing its AI labs that allows you to use natural language searches to search up to date. So lots and lots and lots of stuff in development. And finally, I know that cost is often a factor, and I totally understand that. The way that I think about these tools is I experiment, I use the free trials, and some of them, let's say they cost between $20 to $30 a month. But if one of these tools can help me save an hour of work a month, that can, it's kind of worth the cost to me. So playing around with the free trials can be really effective to see if you think it will help you. And how that's really kind of the best way to determine is using the tools, how you would use in your workday to see if you think it's worth it and what works, what doesn't work, learning the strengths and weaknesses of the different tools. So I'm sorry that I went over time, but I'm happy to answer any questions or comments that you have. I'll just leave that up there. And Orvi, let me know if if any other questions are up there.
Okay, thanks so much, Mê-Linh. And your questions don't have to just be limited to today either. This is something, questions about AI or how AI can help support you in your work or with any of your information needs. We will likely reach out to Mê-Linh for some assistance if some of those come in, but that's the kind of thing you can ask for in a literature search or for any kind of recommendation. And the only question so far is it okay if we post the recording of today's session?
Yes, of course. Yeah.
Okay. So the recording will be available on MHIKNET's YouTube page, and we will be sending out just a quick evaluation that's always really helpful in, did we answer the questions and get into the AI topics that you were hoping for? We're going to ask about Menti. This was the first time we've used Mentimeter for MHIKNET, so we can ask about that. And we'll send the link for the YouTube page too, in case you don't have it. And there, you know what, there was a question that I didn't ask. It's in the chat here, and it's about when training AI, do sites with paywalls, are they harder to access? Okay. Sites with paywalls are harder to be accessed unless the developer pays the site for the access. Even then, the owner of the site would not want to have information being released for free. So how's that relationship working? I know there was a couple instances early on with training ChatGPT, and like YouTube or Wikipedia or someone was suing them. How are those relationships going?
Yeah, so if they're behind paywalls, it can't access the information unless it has negotiated a deal. What's hoppening is that a lot of publishers that have this high quality content are developing their own tools to, so you might see, so Scopus, for example, is one of our big publishers. New England Journal of Medicine, Up to Date, you can see they're all developing their own AI tools that live in-house and then would have costs associated with them, but then would be able to access that information behind paywalls. So I think it's going to take several years for this kind of to play out, for us to think about how it's all going to work together. I won't get into the copyright implications in terms of the training data that's going through the court systems right now, many court systems. But yeah, it's something to think about. One thing though to consider too, though, is when you're doing a search in say PubMed, or most of the time you're not looking at the full text of the article, or it's only looking through the abstract to return the article. So we're kind of used to pulling a lot of information from the abstract, but when possible, all of these tools are trying to get full text access specifically if it's open access. So did that answer the question, or did I miss any nuance there, Orvi?
We'll pause and in case they want to put in the chat anything that we missed. Yeah.
Okay, and I'll just follow up just because I'm looking at what people had put on what they wanted to learn or gain from this session, and there were several comments about using these tools at work. So obviously you're all in different work environments in terms of what is approved for use and not approved for use. As an example, I can share that at the U of M, we can use all the tools that are kind of out there except for DeepSeek. So I would be very cautious about using DeepSeek, which is a Chinese product that has been shown to gather a lot of sensitive data. So that is one tool I wouldn't use. If you are in a health environment, like if you're in one of the regional authorities and they haven't put out guidance or rules on these tools, my understanding is that yes, you can use them, but with the caveat, it is not if you are uploading or using personal, again, private healthcare information. So nothing related to specific patients that would include identifying information. But if you're putting in a case that doesn't have that specific information, I don't believe any of the authorities have banned that, but please, I'm interested if that is the case. And really, things are just changing all the time. So it's just a matter of kind of being aware of what you can and can't use. And what applications are available to use in Manitoba. Almost all of these, except for some of the American ones like the UpToDate AI Labs and the MedPalm, all of these are available for you to use right now. So yes, those are my my summary thoughts. And anything else?
That is everything. And we are slightly over time. So we'll just encourage anyone, as you have more questions, definitely keep them coming. And please all join me in thanking Mê-Linh so much for coming to share her expertise with her today. I know I learned a bunch, and I'm sure Gail learned some too. Yeah, use those emojis to thanks.
Yeah.
Okay.
Thank you.
Thanks
Thanks
everybody.
so much. Thanks for having me. Have a good rest of your day, everybody.